In medical news, as you expect, the medical experts at Baptist Hospital are dedicated to always informing patients about how to prevent various illnesses.
And this month, the focus is on how to prevent and recognize strokes. Our 3 on your side's Jewel Hillary joins us live from the Baptist Health Center in Jackson with more details on that. Good morning, Jewel.
Good morning, Brandon and Katina. Well, the entire month of May is known as National Stroke Awareness Month, and the folks from the National Stroke Association say that, stroke is the 3rd leading cause of death in the United States, and about 137,000 people die from a stroke every single year. So it's definitely a very serious and can be a very deadly illness. And to tell us a little bit more about what a stroke is and how it can be prevented, we're joined by Miss Deniece Ponder. She is an RN as well as an administrator here at Baptist. So thank you for joining us this morning, and just kind of explain to us what is a stroke and how can people recognize some signs of a stroke?
A stroke is the most common way to understand it. It's when the oxygen is cut off to the brain. It could be either from a clot or from a bleed. The most common signs and symptoms, one of the acronyms that we like to use is FAST. F stands for face, facial weakness or facial droop. A stands for arm or leg weakness. The S stands for speech, slurred speech or difficulty understanding. And then time is to call 911. It's very important for patients to arrive to a stroke center or stroke hospital immediately. Time is very important.
Okay. What would you say, what is the length of time that someone should try to get to the emergency room if they think that they're having a stroke?
They should come immediately. Time is brain. You've heard that before, I'm sure. And the quicker that they arrive at the hospital, the quicker that we can treat them. Some treatments are only available for a certain window of time, so it's very important that they arrive immediately. Some of our community think, well, my symptoms are getting a little better, maybe if I lay down I'll feel better, and it's just really important for the community to understand that they do not need to do that. They need to come on and call 911.
Well, thank you so much for joining us this morning. Thank you for that information. And Brandon and Katina, coming up in our next half hour, we'll talk a little bit more about why it's so important not just to go to a doctor, but why you need to go to the emergency room immediately if you think that you are suffering the signs of a stroke. We'll have more in the next half hour. Back to you guys in the studio.